Hello, and welcome to Module 3 of Psychological Appraisal and Assessment. Before we get started, I just want to say a brief note about your discussion thread responses. I thought the responses for Module 2 were actually excellent. I was very pleased that you all had some differing ideas about how to prioritize the issues that were presented in the case, whether to address the suicidal ideation primarily versus the substance abuse, and how the depressive symptoms um, sort of work themselves into your assessment as well. I also just want to say I wrote a pretty lengthy wrap up commentary on the Module 2 discussion threads. It's posted on the Module 3 website, and I would encourage you to please read it. One of the things that I do want to just very quickly mention is I presented this case scenario for you in order for you to kind of struggle with these issues. And as I'm sure you're realizing in our field, there's not necessarily right or wrong answers to these. Sometimes there are right or wrong answers, but in most cases, it's just based on the information that you have and using that information combined with the clinical judgment that you're developing in the best, most ethical, responsible way. And the primary thing that I think that you should take away from this is you just need to have a rationale, a sound ethical rationale for the way that you're responding to situations. And as long as you have that and you can back up the way that you responded with this rationale, then I would say that you're probably in the clear. So when you're reading my response in the wrap up, please know that this is my response, but some of you may have responded differently, and that's not to say that you're necessarily wrong. It's just to say you had a different reason. And when you're acting in the clinic in your clinical activities, just make sure that you have an ethical rationale for the way that you are responding. All right, so enough about that. So now on to Module 3. This week we're going to be learning about cognitive assessment. We're going to specifically focus on intellectual assessment and academic achievement, but most of the slides are actually geared towards intellectual assessment, and I did that on purpose because, in my opinion, it's just critical to know the most common intellectual assessments that are out there, because no matter what context you work in, you're going to either read reports or refer out for this kind of testing, and you just need to be familiar with what the different tests are, who they're normed for, what kind of information they provide, those kinds of things. So I focused the slides mostly on the intellectual assessment. There's a little bit on academic achievement towards the last bit of the slides. So I'd really encourage you to read chapter 6, especially in the text, very closely, because I didn't include a lot of those types of assessments. That's like the SAT, the GRE, those things that you guys have all taken and are familiar with. Um, okay, so now um, let's just talk a little about the importance of intellectual assessment. The way in which you interact with this information is really going to depend on the setting where you ultimately end up working. But just to give you a sense from a forensic standpoint, in my job as a forensic evaluator, knowing a defendant's IQ level, and I'm not really interested necessarily in knowing their specific IQ score per se. I'm more interested in just kind of knowing what level they're functioning. So by that I mean, are they in the average range? Are they in the above average, low average, what? Um, that really helps create sort of a framework for me about what this person's potential capacities may be for the question that I'm assessing. So let's just take an example. Say I'm conducting a competency to stand trial evaluation with a 16-year-old boy whose IQ scores I have for the past 9 years, say. Well, and he's been tested, let's say 3 or 4 times, and they've all consistently fallen in the extremely low range. So he's scored below 70 on these IQ tests consistently since he was, 7 years old. Well, I start to ask him questions about his understanding of, let's say, his plea options of guilty and not guilty as part of my assessment for competency to stand trial. And he responds to me saying he doesn't know. I go through the information and try to teach him, and he still either responds that he doesn't know, or he gets confused, or he kind of goes tangential and gives me a definition for something entirely different. If I didn't know what his intellectual functioning was, I may suspect that he's playing games with me. I may suspect that he's malingering on purpose. I may suspect that this kid is just so incredibly, incompetent that he's not able to answer basic questions. I could have a number of hypotheses about what's going on with this kid. But because I do have the data about his intellectual functioning, and it's consistent data over the past 9 years, and it's been given in, let's say, different settings, and it's all been consistent to fall in the extremely low range, I have that information in combination with his presentation in front of me, in combination with, collateral information that I obtain. I feel comfortable in making a recommendation to the court that he doesn't possess the abilities typically associated with competency. In other words, I would recommend he's not competent. That's a whole nother issue to talk about, the opinion piece, but essentially, I would feel comfortable saying that about this young man because I do have that data. Now, I may even go so far, depending on what other data I have, to say that if he's not even able to get guilty and not guilty after me sitting down with him and teaching him for, half an hour, he might not ever become competent, which that's really important for the court to know. Should we waste time and resources continuing trying to remediate this kid and trying to get him to understand how court works when he's got intellectual capacities that really impair those abilities? So that's one way in which it's very, very helpful to the court and to me as a forensic evaluator to know where this person stands. But the other thing that you have to consider in a forensic context, which I'm just going to touch on briefly here, is the possibility of malingering. You kind of always have to keep this in the back of your head, and I think I mentioned this in last week's video as well. So good practice, which isn't necessarily the standard of practice yet, but good practice includes an assessment of the person's essentially the person's effort when you give them a cognitive assessment. And there's several measures out there, and we'll talk about them more in our weekend in residence, where I have the opportunity to kind of present this stuff to you in the classroom, and I can show you some of these measures. But one example is the TOM, Test of Memory Malingering. Another is the Validity Indicator Profile, the VIP, and these kind of show the person's response style. So are they genuinely trying to answer the questions accurately, and they're just not getting them right, or do they actually know the right answer and they're purposefully not answering correctly, suggesting malingering? So in theory, in good practice, it's really beneficial for cognitive assessments to be accompanied by these measures of effort. That's not necessarily how it is yet, but that is good standard of practice. Now, in a therapeutic context, having data about a client's cognitive functioning is very helpful, for example, in treatment planning, because knowing sort of where the person falls cognitively will help you decide an appropriate treatment method to use. Like cognitive behavioral techniques or psychoanalytic approaches are both very verbal and very cerebral and don't work very well with people who are limited in their cognitive abilities. So in that case, you may, if you have information that this person has pretty low functioning, then you may want to take kind of a more behavioral or hands-on approach.